program has decided to, as they put it, hang up their hat. They're quitting from running what's called the PET machine. It's a scanning device that helps detect cancer. It was originally brought in more than 15 years ago, and the doctor in question, Dr. Demeter, is quitting because of a complete lack of support from this government and especially from Shared Health. I'll just quote some of the things, just as an example. They didn't want, there was financing in place to bring in a new machine. That machine, which would actually have expanded capacity, was cancelled. The Shared Health pushed for the cheapest option in order to locate a new scanner, which they all knew there were already problems with the location it was in. But really specifically, the current wait time for PET scanning is 4 weeks, which the doctor says is unacceptable for newly diagnosed cancer patients. That for a number of years, that the inability to make decisions on the part of Shared Health and move forward has had profound negative impacts on staff morale. That the Health Sciences Centre Diagnostic Imaging Director position has been vacant for 3 years. The Cyclotron and Radio Pharmacy Director positions have been vacant for over 2 years. And what happens is everybody has to stretch. And not only that, they're being told they have to cover those positions, not knowing whether they'll ever have a job in the future. As he put it, to be blunt, they're essentially being told, after busting your asses off to cover off all these duties, feel free to apply for your job when it's posted. And that's exactly what's been happening. Is that hundreds of people in the healthcare system have been told, well, you know, we're eliminating your position, you could apply for it again. And finally, he said, putting patients first through innovation and rational program planning is not possible. So what does that say about our healthcare system? That he said, our healthcare system is certainly broken now, and Shared Health leadership should be held accountable to fix it and step aside or let someone else do it. And I did just want to mention, because this is also happening on the day we're talking about a wage freeze. This is all because of freezes. This is all because the PC government wouldn't put money into replacing a PET scanner. So what's happening? We're losing doctors. We had UMFA here today saying we can't hire university professors because our salaries are too low. And in the Manitoba Court of Appeal decision, it actually sided with UMFA, with the U of M Faculty Association. It said, look, there's no question that the government of Manitoba interfered in contract negotiations in ways that are unacceptable. So it was, as a finding, it went both ways. But it's for the PCs to claim any kind of victory today over the fact that they've won a court case saying that they've frozen, that it's okay for them to freeze wages. We're living with the consequences of it, because we can't run programs to train new nurses at the U of M. We can't train people in computer science at the U of M because we can't hire people there, because this government has frozen everything, and we're losing doctors left, right, and center. We have a massive backlog of nurses who because people have been driven out of a system where it's impossible to work, because the PCs have starved our education system and starved our healthcare system. And so the people who work in it are voting with their feet. You don't, the fact is we do live in a democracy, and even though the fact that the courts have said it's okay for government to force these freezes on people, people don't have to live with them. They can go and work somewhere else. They will leave Manitoba, and they are leaving Manitoba. And it's a disgrace that that's happening, because that's a choice on the part of this government of what they're doing. And it's again, it's a Pyrrhic victory for this government to say that the fact that the Manitoba Court of Appeal has said it's constitutional to freeze wages. We're living with the consequences of this, and it's devastating for our universities, and it's devastating for our healthcare system.